We do freeze eggs for people for elective reasons. We also freeze it, for future fertility for people who are facing a cancer diagnosis. You would come in for a consultation with us. We would generally order some lab work that would be done at a certain point in your cycle. And again, probably within 4 to 6 weeks. If you're in a big hurry and you want to go quickly, which is what most of our patients are, it's probably going to take something along that time frame. It's not long. It's usually more or less one cycle, but we just have to also, you have to be starting meds at a certain point, and when you arrive in the office, it's probably not possible to start that week, and also you might not be at the right point in your cycle, but pretty quickly. Years. You can probably keep them a decade. In fact, we don't really know the extent of possibility there. The eggs are stored in liquid nitrogen tanks, and I think that's at something like, I don't know, minus 300 degrees Fahrenheit. You could Google it. Liquid nitrogen is really cold, and pretty much all cellular degradation stops. So they have been kept for many years, and it's not a problem for the viability or the likelihood of success. But what happens on the other side of that equation is you, or whoever, if you're going to use your eggs in the future, you're getting older. So as a woman gets older and gets into her later 30s and early 40s or even older, if we transfer an egg from when she was younger, an embryo that came from an egg when she was younger, it's going to have the chance of implantation that goes with the younger age, but there will be an increased chance of pregnancy complications just related to being pregnant when you're older. So, a woman in her 40s carrying a baby has a higher rate of things like getting high blood pressure or getting diabetes when she's pregnant. So, it's important to realize the egg will be fine and the embryo has the same chance of implanting ultimately, but the mom could develop some health challenges if she waits a long time. I don't know if that's an egg. It's a single cell, and that's the embryo that we freeze, and that has hundreds of cells in it. And I showed you that picture because the egg, it's actually full of a lot of water, and water is difficult to freeze. So you will not have as good a survival of frozen eggs as you will of frozen embryos. The second thing is, with an egg, it's one cell, and that cell may not have normal chromosomes or normal machinery in it, but we can't tell that when we freeze it. So if you freeze eggs, you have a lower, I'm going to say, yield, I don't know what else to call it, in live births per egg than you would frozen embryos. Frozen embryos work, by comparison, frozen embryos work very well. Just to give you some idea what I'm talking about, if you're under 35 and you freeze 10 eggs, you probably have something like a 50–60% chance of one live birth. If you froze 10 embryos, you would have a much higher chance of having more than one baby with all those embryos. So they're very different processes, and the success rates are very different.